Hello, good morning. Welcome to the CCI Stakeholder Call. Thank you all for joining us. We appreciate your time and are looking forward to having a good conversation today. This is Hillary Haycock from Hra Consulting. I'm going to go through just a little bit of housekeeping and then hand things over to Sarah Brooks. First, I just want to make sure that everybody can hear us. So if you can hear us, could you please raise your hand by pressing 1. Okay, great. Looks like most folks can hear us. That's great. Just in case we have some technical difficulties on our end and get disconnected, you will use the exact same login to log back onto the call, the same call-in number. And as soon as if something should happen, as soon as you resolve things on our end, you will hear us once again. So just call back in if you get disconnected. And then once we're ready to take questions at the end of the presentation, again, if you press 1 to raise your hand, and then we will go through. And now I would like to hand over to Sarah Brooks.
Thank you. Good morning, everyone. And thank you all for joining us today. So we have a number of exciting topics for you today. We'll be covering enrollment, HRA data, initial CalMediConnect evaluation results. Many of you may have seen some of that roll out recently. We'll provide an update on a piece of our outreach efforts, talk a little bit about the revised guidebook and choice book for those new to Medi-Cal or moving within CCI counties, and then also want to share some new information with you about our new Beneficiary Toolkit. And then finally, of course, an opportunity to answer any questions that you may have. So first, I will start with the budget. I think before we get into the meat of our agenda for this call, definitely want to address that as an issue, as I know that it's a question on many stakeholders' minds. Obviously, the budget conversations are an important part of the future of CCI. Those will still need to take place in the months ahead, and so really we don't have much of an update for you in regards to that today. Our focus right now is on ensuring our beneficiaries are receiving the information that they need and the quality care that they do deserve. In terms of enrollment, the latest CalMediConnect enrollment dashboard for November is posted on calduals.org. It did get posted late yesterday. Overall, as of November 1, we have 116,356 beneficiaries enrolled in CalMediConnect plans across the 7 counties. That ranges from about 46,000 in Los Angeles to 3,000 or 3,200 in Orange County. Additional information, as I noted, is included on that dashboard. That includes, as has been published or issued in the recent months for the dashboard, information on disenrollment by county, race, ethnicity, language, and additional information for your reference. Related to health risk assessments, many of you know that we have issued several HRA dashboards. We did want to make sure that you were aware of the fact that we did issue the latest HRA dashboard in October. That dashboard is a quarterly update but shows cumulative data dating back to April 2014 when the program itself did first get implemented. At a high level, we do see that the data is mostly in line with the previous dashboard, so not a lot of changes. CalMediConnect health plans completed HRAs on 89% of beneficiaries within 90 days of enrollment for beneficiaries who the plans were able to reach and who were willing to participate in the HRA process. So as a reminder, that percentage is really a reflection of what HRAs the plan was able to complete, and of those that the plan was able to complete, how many were actually completed. The data also shows that 38% of beneficiaries were unreachable and 10% were unwilling to participate in the HRA process, which I think is an interesting point to note. And we'll talk a little bit about the data in a moment here in relationship to CalMediConnect evaluation results. But we did see in the responses to the focus groups that beneficiaries were not particularly fond at times of the HRA process, and so that's something that we're continuing to explore and think about. As a reminder, unwilling beneficiaries are those who were contacted by the plan but chose not to participate in the HRA process, and unreachable beneficiaries are beneficiaries who the plan has attempted to contact with no success. So we're really excited to start having initial data related to CalMediConnect and the evaluation. Most of you know that the SCAN Foundation did fund 2 different approaches or studies related to CalMedi Connect. The first, a rapid cycle polling project. The second, a 3-year actual evaluation of the demonstration itself. The early findings from focus groups conducted by both of those different entities rolled out, and presentations have been done at the LTSS Summit recently and in other contexts and other venues as well. You know, I'd like to say that we are really encouraged and excited about the data. Overall, beneficiaries in CalMedi Connect health plans are satisfied with their doctors, their choice of doctors. So 77% were satisfied with their choice of doctors and 76% with their hospital. 77% were satisfied in terms of the way that different healthcare providers work together to give them services under the plan. 83% were satisfied with the amount of time doctors and staff spend with them, and 76% were satisfied with the information provided by their plan to explain the benefits. 80% of beneficiaries were confident that they can get their questions answered about their health needs. So we are really excited to see that the enrollees see the program's value, and so once beneficiaries are really enrolled in the program, we are seeing that they like it, that they are satisfied with it. We did hear at the same time through the data, which really shines a light on areas that we need to continue to strengthen and work on, that there were some issues with the transitions. For example, transition issues often led to early disenrollment from CalMedi Connect. However, as I noted, those who stayed enrolled were satisfied in how issues were resolved. So I think what we heard in the data is that early on there were some bumps in the road as transitions occurred or as the plan or the program was implemented. But once they were resolved, beneficiaries really liked the program. They really were satisfied, and so we're excited about that. You know, other things I would note is that beneficiaries often lacked awareness about CalMedi Connect benefits, including the availability of a care coordinator or continuity of care. And so these are areas that the department knows that we need to continue to focus on to make sure that we are communicating with our beneficiaries in the way that we need to make sure they know what benefits are available to them, that they know what their rights are, they know what continuity of care is, that they know what is available under the program to them. And the other thing I would just note is that beneficiaries who opted out were weary of change in their current health care services. So 84% reported that as an issue for them, and of losing their doctor. So 71% reported that. So I think the general takeaway there is that, you know, beneficiaries were not necessarily looking for change, that they were comfortable where they were, and so that was a high reason for the opt-out, is that they didn't want to experience change on their end, and in particular lose their doctor. We are continuing to take a look at the data and further analyze it. We expect to have more data from the field research rapid cycle polling come in soon, and so we're excited to continue to work with all of you as we get that new information and data to think about how we continue to strengthen and carry forward with the program. With that, I'm going to pass it over to Hannah Katch, who is going to provide further updates today.
Thanks, Sarah. So speaking of working to raise awareness, I wanted to provide a brief update on some of our work to reach physicians in different ethnic communities in California about the benefits of the CCI. So the team at Harbidge is working with the CMA Foundation's Network of Ethnic Physician Organizations, or NEPO, to conduct some targeted physician outreach and education around CalMedi Connect. And I think we've mentioned this work previously on the call. Earlier this month, the Harbidge team collaborated with NEPO on an event for the Chinese American Medical Association of Southern California in Los Angeles, and more than 60 physicians attended. Many of them have already requested staff trainings and additional resources, so we're really excited about this work. The next presentation is planned for today and will be in the Korean American Medical Association in LA. And at each of these events, our team at Harbidge distributes physician toolkits. These events are tailored specifically for physicians, not their staff, and the presentations and events are in the works for Armenian, Russian, Indian, and African American physicians. So this work with NEPO's member organizations will continue into 2016. And I'd like to take this opportunity to just remind everyone on the phone that the CCI Physician Toolkit is publicly available on calduals.org/providers. So please do take a look at that resource. It's a really fantastic resource for physicians. The Harbidge CCI outreach team is also available and happy to deliver presentations or webinars or come to events or in any way help educate providers about CalMedi Connect. It's what they're here for. So please reach out to them if there are opportunities for them. And we are always looking for new and creative opportunities to reach physicians or caregivers or other non-medical providers to educate them about this program. So we'd really welcome any ideas or feedback that you all have for us about this work. And as always, you can reach out to the Harbage team directly or send an email to info@calduals.org. I want to also just provide a brief update on the revised CalMediConnect and MLTSS guide and choice book. So as many of you will remember, we released these draft materials for comment a little while ago, and we received comments from more than 30 organizations. So thank you, everyone, for your very thoughtful review and feedback. We know these resources are really important to all of you, and they're really important to us. We're committed to getting these right, and we are currently reviewing the feedback and working through some of our internal processes. One of the more common comments that we received was a request for us to get beneficiary feedback on the materials, and we agree, absolutely. Getting beneficiary feedback is crucial to make sure that they work for the targeted population. So we would like to work with you to do some informal targeted beneficiary feedback in a timely way. So if you have any ideas or groups of beneficiaries who we can work with on this, please do let us know. And please send that information to info@calduals.org as well. So finally, I am excited to announce a new draft CalMediConnect Beneficiary Toolkit. We have talked in the past about how with passive enrollment over in most of our CCI counties, we really need to reach out to new and existing eligible beneficiaries and help them understand their options and how CalMediConnect may benefit them. We also want to help these beneficiaries better understand how to navigate their MLTSS plans if they do keep their Medicare benefits the same as they are today. So as part of that effort, the Harbage team has put together a beneficiary toolkit. Similar to the physician toolkit, the idea is to have sort of a comprehensive resource that tells a cohesive story of the CCI and CalMediConnect, and also contains standalone fact sheets that cover various topics and aspects of the CCI and CalMediConnect in more depth. So for example, the toolkit has a fact sheet that addresses many of the questions that eligible beneficiaries often have. For example, can I keep my doctor? How do I keep seeing my current doctors? Does CalMediConnect help me get the care I need? And what is an HRA and a care coordinator? It includes a fact sheet that helps explain some of the particulars related to managed care plans. For example, the definition of a network, because we know duals are new to managed care in general oftentimes. We hope this toolkit will be an easy-to-use resource for CalMediConnect eligible beneficiaries, as well as their caregivers and stakeholders, and that will be online and used in outreach activities. As with all of our materials, we're really committed to working collaboratively in developing this resource, and we want to get stakeholder feedback on the draft. So we plan to do some informal beneficiary testing as well after stakeholders have had a chance to review. So in the near future, we will be sending out an email with a link to that draft. And we're also going to ask that comments and edits be submitted to info@calduals.org. The email we send out will include a deadline for comments, which we anticipate will be in mid-December. So as always, your participation is really important to us, and as we continue to implement the CCI. So we hope you'll take a minute to look at that draft and send us any comments or feedback. So that is it for today's agenda and all of our updates. So we're going to just open it up for comments and look forward to hearing any comments or questions you may have.
Great, thank you, Hannah. So again, if you would like to ask a question, you can raise your hand by pressing 1. Our first question is from Therese Lawler.
Hi, I've asked this question in a version once or twice before, and I'm slowly navigating the confusion that some of our residents, I work in a long-term care facility in San Francisco, are changing their plans when they are being auto-enrolled into Santa Clara's managed Medi-Cal plans because their Social Security address is still in Santa Clara County, though they physically live in San Francisco. Do you have any ways of dealing with this? Our issues currently are with residents who have a community spouse still living in Santa Clara. Therefore, the SSI benefit is required to stay out of Santa Clara County, and therefore they are being auto-enrolled into either the Blue Cross or Santa Clara Family Health Plan, which does not pay for their cost of care at the long-term care facility in San Francisco. And we're looking at having to discharge 3 or 4 residents who have been here more than 10 years.
So this sounds like it's probably an issue with Social Security, but if you don't mind sending your contact information to info@calduals.org, we will try to connect you to the right folks at the department who can help you navigate this in detail.
Thanks for raising that issue.
Yeah, thanks. We'll try to help you get. Can folks press 1 again if they've got a question? I think we had a couple. There we go. Robert Mclaughlin, your mic is open.
Oh, thank you. It's Robert Mclaughlin from the Assembly Committee on Aging and Long-Term Care. I was just a little disturbed by the previous person's comment about some people facing discharge from a long-term care facility. And I'm wondering what kind of a timeline is going to be applied to that situation. It sounds kind of urgent. You know, transfer trauma is a very significant issue for people who live in long-term care facilities, and I'm just wondering if you can give me an idea as to when I can expect to hear that has been dealt with for purposes of informing my boss and, you know, the members of the legislature.
So, Robert, thanks so much for your question and comment. I mean, as you know, we work through these issues every day and in a timely manner. You know, we would need to see the email from the woman to be able to further investigate. It does sound like it's not actually specifically tied to something that we own or have control over, but look forward to receiving the email from her so that we can further investigate and assist her.
All right. Our next question is from Jordana, and the last name is cut off on the software here. So, Jordana, go ahead. Your mic is live.
Hi, good morning. It's Gordana, and thank you. Lots of good information. Just back to the surveys really quick. I'm trying to pull it up, and I'm having some software issues on my end. How long were the enrollees that you surveyed? How long have they been with CalMedi Connect when the surveys were conducted?
You know, it really varied depending on, we sampled from all enrollees or members that had been assigned to a particular plan, so it varied depending on when the beneficiary was transitioned. But I do want to note that we also looked at non-CCI counties so we could have a comparison group as well for the focus groups that were conducted for the evaluation. So look forward to hearing additional comments and feedback from you on the data once you're able to see it.
Thank you, yes, and I'll send any additional questions via email. You guys are good.
Okay, great. Thank you so much. All right. Amber Cutler, your mic is live.
Hi, thanks guys, and thanks for all the information today. I actually have kind of a weedy question that you guys might not be able to answer on the call, but I thought I'd raise, is that from month to month on the enrollment dashboard, the opt-out rates continue to fluctuate in counties where passive enrollment has ended, with sometimes the opt-out rates being higher in certain months or lower, but kind of all over the board. And I was wondering if you could address why the opt-out rates would be changing since in those counties the passive enrollment process has ended.
So we'll need to go back and take a look at that, Amber. You are right that given that it's stagnant now, there shouldn't be changes. I would assume there could be some changes in the system in terms of the data feed that we're getting and kind of what has happened along the way, but we'll go back and take a look at that.
All right, great. Next we have Anwar. Your mic is live.
Hi, thank you. We've all been working really hard to make sure that the demonstration is very successful, but I'm hearing that the governor might actually pull the plug come this January. Is that true, or can you give some insight on that?
So at this time, the program is still continuing. As I stated earlier in the talking points, there is a consideration and decision that will be made during the budget process that will roll out over the next couple of months. But at this time, there's no indication either way. And so if you are hearing that, then it's rumors that are going on out there. But we do appreciate you following up and asking us as opposed to, we just appreciate that. Thank you.
Thank you. All right, our next question is from Rafi.
Hi, good morning. In the outreach efforts with the doctors and ethnic communities, what is the overall goal? Is it for encouraging them to participate in CalMedi Connect networks, or to just educate them to not encourage people to opt out? What's the overall goal?
Sure. So as we have discussed in previous calls, we have been looking at the data about the individuals who are eligible for CalMedi Connect but have chosen not to participate. And in particular, we've been able to do a deep dive on some different demographic factors, including race, ethnicity, and language. We've found that for some racial and ethnic and linguistic groups, they're opting out at much higher rates than other beneficiaries. And we just want to make sure that when we are providing outreach and education, that we're doing so in a culturally and linguistically appropriate way. So our goal here is to reach out to some of the physicians who serve these communities to make sure that they're educated about the program. If they or their beneficiaries choose not to participate, that is entirely their choice. We just want to make sure that they have all of the information going forward.
Thank you. All right, our next question is from Janelle. Your mic is live.
Hi, yeah, I saw the California's Legislative Analyst Office report today about CCI, and was just wondering if you had any comments about what they had to say. I mean, in general, they sound very overall hopeful that CCI will continue, even if the MCO tax does not go forward. I don't know if you guys have read the report. I mean, I'm sure you have, or seen it or heard stuff, but I was just kind of curious if there were any thoughts from you guys on that.
Thanks for that question. We are still reviewing that report, and I think in general it's continuing to stay focused on strengthening the program and making it as accessible as possible to our beneficiaries.
Thank you for the question. I think we have Gordana again. Your mic is live.
Thank you. Yes, it's Gordana Vukatic again. And I noticed I was looking at the health risk assessment dashboard, and just an observation / comment. It looks like with some of the health plans, the number of health risk assessments completed are much higher than with some of the others. Is it possible that there's a training issue at the health plan level, or what do you think is there going on?
Yeah, thank you. So every health plan is approaching HRAs a little bit different. Some are doing the HRAs in-house, some are using vendors, some are relying on their delegated entities. So they all have sort of slightly different approaches to how they're doing the HRAs. We are working actively with all of the plans, reviewing, helping answer questions, helping them work through the issues. The plans are learning from each other's best practices. And so I think that just reflects sort of a different plan approaches, but all plans are, required to reach out to beneficiaries within a timely manner, and we know all the plans are working on it. They just have slightly different approaches, and so again, we're working and trying to create some and collaborative sharing of best practices to help all plans improve their HRA completion numbers. Thank you for that question. Are there any other questions? Just as a reminder, if you want to ask a question, press 1 to raise your hand. And we have another question from Therese.
Hi, yes, sorry. I just wanted to let you know that I have written CalDuals, the California Ombudsman for California Coordinated Care Initiative, Santa Clara County, and I've been speaking to very helpful people at the MLTSS branch up at your program. And I think somebody asked how soon a possible discharge could happen. That discharge could happen within the next few months if we cannot get these corrected. What I need to know, and I've just written an email again to CalDuals, what I need to know is what address records California Coordinated Care Initiative, Department of Health Care Services, uses to determine a beneficiary's eligibility? Do they use the address where they live and receive mail and services, or the address where their SSI benefit is managed?
We use the address that the beneficiary provides to us through the application process, which they are also responsible for then updating regularly to ensure that if they move or if there is a change, to ensure that they receive all information and communication. We do appreciate you sending the email. We'll take a look at it. We do follow up with all emails that we receive. Thank you so much.
Thank you. All right. Are there any other questions? Again, press 1. All right. We have a question from Hanan. Your mic is...
Hi, this is Hanan from Allied Care. Just to the regarding the point the lady prior to me was making, that would actually be a very good point to put in some of the beneficiary information and frequently asked questions, because address, even like for Medi-Cal beneficiaries, is really critical to use sort of the address, the mailing address, the actual physical address, and if it's the beneficiary's responsibility to update any their address which may impact their benefits moving forward, or a change of their benefits, that would actually be a pretty good thing to put in your frequently asked questions if it's not there already. And then I have one more question regarding with the opt-out rates and fluctuations. I'm actually very interested in the dashboard and some of the rationale as it relates to the calculations. And is there a forum or working group, because this is actually my first call, is there actually a working group that addresses data calculation and some of the factors that would influence fluctuations or variances from time to time?
Thanks so much for your comments and question. We would definitely be interested in your feedback on our on the draft toolkit that we'll be sending out. If there are places where we can highlight information about change of address, we absolutely agree. It's really essential that beneficiaries change their address with us when they move, since that is the primary way that we reach them. So would welcome your feedback on that. In terms of looking at enrollment changes and data, we do a fair amount of that in-house here, but as always, we monitor our info@calduals.org email very closely. So if you have questions, suggestions for us, if you notice changes in the data, we would really welcome any of those observations or suggestions.
All right, great. Our next question is from Dan. Dan, your mic is open.
Thank you. I wanted to follow up on the address question again, and to see if it wouldn't be possible where healthcare options could collect the updated address and contact information. We know that healthcare options isn't able to enroll someone unless their address and contact information matches what they have on file, and people are then referred to Social Security to first try and make those updates, and it ends up being a bit of a runaround, which many of these beneficiaries may fail to follow through on. So I'm just wondering if there could be an opportunity where healthcare options could collect the updated data and then somehow connect that to Social Security to create the update.
Thank you very much for the question and suggestion. So this is unfortunately the way that the med systems work, is that the data files are owned by the entity through which the beneficiary became eligible for Medicaid. And so unfortunately, that means that if they became eligible through SSI, only the Social Security Administration can update their address or other information. If they became eligible through the county, they have to register any changes with the county. HCO does not have access to update any information in meds. We know that this is a very frustrating and difficult issue both for beneficiaries and their families. And I know that the state has been working on updating meds for some time. Unfortunately, this is the system that we have, and so when beneficiaries become eligible for Medicaid, I do believe the materials ask them to update the agency through which they became eligible as quickly as possible. And that, unfortunately, is just sort of how the only way that the data systems can be updated. But thank you for the question and the suggestion. Right. Again, if you have a question, press 1 to raise your hand. All right, great. Well, folks should definitely stay tuned. If you should be on our email list, and as soon as the Beneficiary Toolkit is available for stakeholder comment, we will be emailing that out with the deadline. We really look forward to having everyone's input on those materials, both edits to the language, suggestions for anything that maybe we missed. So please stay tuned to your email inboxes for that. And if there are no other questions, I would like to thank everyone again for your time today. We really appreciate all of the robust stakeholder participation in making CalMedi Connect and the Coordinated Care Initiative work well for beneficiaries, and have a lovely rest of your day. Thanks.